Welcome to Medical Marijuana and Wellness. Tonight's topic is relief for a range of conditions, how medical cannabis can help and its benefits. Joining me tonight is Amy Green. You do a lot of this work. You work at a clinic and visit with patients and work with patients every day, don't you?
Correct. Yeah. So a lot of my job is I help patients with crafting a treatment plan that is hopefully going to get them on the right path towards getting the relief they're looking for.
Let's tap into some of your experience and let's talk about how people can look at a plan that can really help them. Prior to this particular webinar, what we did was we had webinars on the endocannabinoid system, the terpene toolbox, certificate of analysis, and journaling, your self-guided dosing. Please refer to those webinars as we talk about those particular topics, because we're not going to cover them tonight. We're going to move right on to leveraging that knowledge base. Tonight, what I want to talk about is medical marijuana as a treatment option for a range of chronic conditions, and also which consumption methods and products should you choose in order to address your particular condition. So, Amy, let's start off by doing some of the basics to remind people what are the components of cannabis. These are kind of important.
Yeah. So these are the building blocks of cannabis. So you're going to have cannabinoids, terpenes, and flavonoids. So cannabinoids, the most common ones that you think about when you think about cannabinoids are going to be THC, which is the psychoactive part of the cannabis plant, and then you have CBD, which is the non-psychoactive part of the cannabis plant. And they're both very, very important cannabinoids that show up in large quantities naturally in the cannabis plant.
I tend to look at cannabinoids like Legos. Our receptors each have different shapes and forms, and the various cannabinoids also have shapes and forms that actually link to and bond with those particular receptors, and that's the job of the cannabinoid. Once it does that bonding, it opens up the door for the terpenes, which the terpenes are really important because what they do is they basically deliver the medical benefits. They and the flavonoids really deliver the medical benefits you're looking for from cannabis.
Certainly. And there are so many terpenes. This is just an example of 3 of the more common terpenes that you might find. Terpenes are what's going to give cannabis its smell and its taste. But just like you said, it is going to, the terpenes will provide a lot of the medical benefits that you actually get from the cannabis plant. And as noted in this list here, terpenes are heat sensitive. So the temperature at which you use products can affect the action of the terpene.
But also, really, the 3 components, cannabinoids, terpenes, and flavonoids, create something or cause something called the entourage effect.
Yeah, so the entourage effect is what we expect to happen when the cannabinoids, terpenes, and flavonoids are all working together in your body to provide a full range of benefits from the cannabis plant. So instead of just isolating cannabinoids or terpenes, when we put them all together, they work better together.
Right, and that's very important to understand because that's really the magic to medical cannabis. Now, we talked about terpenes. There are actually over 200 different terpenes that have been identified, 120 of them being studied. These are kind of like the Hall of Fame. These are the big 8 that are really out there that are found in most of the cultivars and cannabinoids that we find that are out there.
Yeah, and these, just like you said, these are the big 8. So these are terpenes that you would find in larger quantities in naturally occurring cannabis. There are other terpenes that you'll find in smaller amounts, but these are definitely the ones that are most prominent.
And what's interesting is when we take a look at all the terpenes that are out there, and I know this is a extremely busy chart, so we're going to just kind of cover this briefly and then show you how this works. But here are the different terpenes that are out there. Each of these address a particular symptom and effect. We're actually able to chart that, and this is very important to being able to determine what products to use or which terpenes to use for each of the conditions. Amy, let's spend a moment and actually talk about that a little bit. And let's start with arthritis. If you have arthritis, you have some conditions that really identify the terpenes you should be using.
Yeah, certainly. So with arthritis, we're expecting symptoms like joint pain, redness. They might have some minor swelling or sensation of heat in the joint or around the joint. So we have some specific terpenes that we look at to actually address those specific symptoms. For the pain relieving part of it, pretty much every terpene is going to provide pain relieving properties. Same thing with anti-inflammatory. But if we're looking at something like needing a muscle relaxer, say to just help with some of that inflammation and relax the muscles a little bit to give some relief for arthritis or muscle spasms that might be happening because of arthritis, we might be looking at a terpene called myrcene. And the cool thing is that helps with muscle relaxation, which can be really important for treating arthritis.
So this is how we kind of read how that's out there. Same thing applies to stress and anxiety.
Absolutely. So, with stress and anxiety, patients might experience headaches, some high blood pressure. They might have a sensation of chest pain or heart palpitations. They can also get skin rashes. And oftentimes, anxiety is also common with sleep disturbances. When we start looking at what terpenes we would want to use for that, we'd be looking at limonene, linalool, myrcene, and caryophyllene. Each of those specific terpenes are going to do a little bit different things, but the big things is they're going to elevate the mood. They're going to reduce stress and anxiety. They can also help relieving some of the symptoms that the patient might be experiencing, such as the, relieving some heartburn or gastric reflux if they are having any upset stomach from the stress or anxiety. It can also have, caryophyllene, for example, is an antidepressant. So if they are experiencing any depression as a result of their stress or anxiety, it can help a little bit with that as well.
Now, let's talk a little bit about PTS or PTSD. This is something that is common, not just we associate that with the military, but candidly, there's a lot of people that have PTS from basically an event that really changes your life.
Absolutely. PTS and PTSD are not limited to the military. It can be early childhood events. It can be mid-childhood. It can be adulthood events. It's anything that is going to cause extreme anxiety, anger, guilt, shame, nightmares, avoidance of friends, family activities, and places. People might also experience flashbacks or constantly think about the event, like ruminating on it.
Mhm.
And there are some terpenes that can help with that. For one, we're always going to look at the pain relieving properties if they are experiencing any pain that from the event, and that pain might then trigger a PTS event. We're also looking at mood elevation properties of like limonene, linalool, terpinolene, and borneol. And then we're also looking at things like improving insomnia and helping with sleep. That's going to be your linalool and your borneol. And then if a patient is having alcohol cravings and that is how they are medicating for their PTS or their PTSD, caryophyllene can actually help with reducing alcohol cravings and make it so that they're not as dependent on alcohol as a coping mechanism. And so it can be helpful for transitioning from using alcohol as a coping mechanism to using a more natural product like cannabis.
So cannabis has been very effective. I know that a lot of people I talk to, especially with military groups, swear by it. I think it's also important to point out that things like alpha-pinene is something that you may want to avoid if PTS is one of your conditions, because it actually brings back short-term memory.
Yeah, and it is one of those things, like if you do buy a product that has pinene in it, you don't have to completely avoid it, but I would tell you that it is dose dependent. So if you find a product that has alpha pinene as the primary terpene, like it has the most of that, I probably wouldn't recommend that for somebody with PTS or PTSD. But if it's not the primary, like it's not the most prevalent terpene in that product, then it's usually going to be okay because it is very dose dependent.
Let's talk a little bit about a very important one, cancer. I know that a lot of people have questioned whether cancer can help with cannabis. And I want to point out that although research into medical cannabis here in the United States is restricted because it's a Schedule I drug, cancer research has been being done overseas. And 26 years ago, country of Spain built a lab for Dr. Cristina Sanchez just to study cancer and cannabis. And she's been putting out studies ever since then, primarily focusing on breast cancer and various types of cancer. She's addressed, out of the 206 types of cancer, she's addressed about 30 of them. And she's done some great research. So research is being done. We do know that cancer can be addressed by cannabis. But I think this is important to point out because there's a lot of different characteristics that cannabis can really address.
Yeah, certainly. So there's kind of two different parts when you're treating cancer with cannabis. One is you're treating the direct effects of that cancer on the body. So that's going to be the malignant cell growth, the cell division, and what the cancer is actually doing to the body. So, a patient might be experiencing fatigue, weight loss, bleeding, fever, chills, night sweats from the actual cancer. And then if the patient is being treated for cancer, they may also be experiencing side effects from the chemotherapy, immunotherapy, radiation therapy or other medically prescribed therapy that their provider has recommended for them. And cannabis is really good at addressing the side effects of those treatments as well.
Right. I think it's important. If you take a look at the terpene profile versus the side effects, this is really important.
Absolutely. So a big thing with cancer is we always want to address pain first and foremost. And there are many, many very helpful terpenes for pain. We're also going to address, helping out a chemotherapy product if that is what the provider has recommended. And there are a couple of terpenes that actually augment and kind of assist in the delivery of chemotherapy throughout the body and can make chemotherapy more effective. So that would be your caryophyllene and your granule. So you have couple different ones, and then the potential tumor reduction properties. So we'd be looking at limonene, caryophyllene, and the granule again. And there's a lot of different terpenes that are going to have benefits for the patient for cannabis for cancer treatment, and that again is either the effects that cancer is having on their body or the symptoms that they're having as a result of cancer treatment. Cannabis can help with both of those.
And I think it's important to point out that not only does it help with a lot of the symptoms, it also helps relieve the stress and anxiety that comes from cancer. Because when you get diagnosed with cancer, it's a stressful event, that's for sure. Let's talk a little bit about pain management, because this is one of the main reasons why people use medical cannabis. And really, pain relief and inflammation is the key here.
Yeah, absolutely. When we are addressing pain, a big thing is we're really looking at reducing inflammation throughout the body. And as you can see from this chart, every single terpene that we know of that is naturally occurring in the cannabis plant is going to help with inflammation throughout the body. As it's addressing inflammation, it's usually targeting kind of the root cause of a lot of pain that patients might be having. So if we can address inflammation, we're also addressing pain.
I think that's really important, because inflammation is one of the main contributors to pain that's really out there. One of the main reasons that people use cannabis is for fibromyalgia. Tell us a little bit about that.
Yeah, absolutely. So fibromyalgia is an autoimmune disease, and it's hallmarked by flares throughout the body, and patients can experience just extreme physical pain, sensitivity throughout their body, muscle stiffness and muscle spasms, fatigues, poor sleep quality, cognitive problems, also called like fibro fog or fibro brain, headaches, IBS. There's a lot of different things that happen in the body because of fibromyalgia, and cannabis does have some really helpful benefits when patients are trying to treat fibro.
And if you take a look at the terpenes that identified for that, again, taking a look at the different conditions that we're trying to address, there's quite a few terpenes that can really help with fibromyalgia.
Yeah, absolutely. Of course, we're always looking for the analgesic or pain relieving properties. A big thing with fibromyalgia is we're also looking for that anti-inflammatory properties, and then muscle relaxants. We're looking for all of the different ways that we can improve this person's life through cannabis and terpenes. And in the end, it is just connecting the symptom that you're trying to treat to the terpene that is most likely to give you positive effects.
And I think also the neuroprotecting capability is really important for fibromyalgia.
Certainly. So you'll have the limonene and the borneol for that.
So let's talk about also sleep, because a lot of people turn to cannabis to help them not only fall asleep, but stay asleep.
Yeah, absolutely. So sleep is one of those things. We can't live without it, but it's kind of hard for some people to achieve. We do know that there are some terpenes that have sedating properties, and those are going to be really excellent for falling asleep. So the couple that I always recommend are going to be linalool, myrcene, and terpinolene. Those are very sedating terpenes, and so it makes it a little bit easier to get to sleep. And then because of the long time that it does take for some cannabis products to process through your body, like for example, the edibles or the tinctures, we do expect those sedating effects to then last quite a long time, which is super helpful for staying asleep.
Yeah, that's a good point. We'll talk about duration in just a moment, but yes, that's an important point to point out. Also, one of the things you mentioned earlier, I think it's really important in using cannabis, is the temperature that you're using for your vape pen. I know that people don't realize that as cannabis is very heat sensitive, what's more heat sensitive is the actual terpenes themselves. If you look over here, there's different heat ranges, and you can see that the different terpenes are either created or burnt off at these different heat ranges. So if we're looking at things like myrcene, we're looking at things like terpinolene, linalool. What you're doing is on your vape pen, you want to actually set your vape pen for this particular temperature setting to bring out the best and actually to bring forward these particular terpenes. A vape pen, when you buy one of these, typically has a button on it. Typically, that button can set a low, medium, and a high heat range. A very inexpensive one probably doesn't have that capability, and I'd probably not use that one. I'd use one where you can set the heat range. But typically, like for example, in my particular case, because I'm looking for something that'll help me with my both pain and also with inflammation, I set my vape pen at about 350, right in this range here, because it gives me the capability to look at myrcene, to look at things like terpinolene, linalool, limonene. I think these temperature settings on these vape pens are important, Amy.
Absolutely. I do always recommend buying a battery that has multiple heat settings, and ones that actually allow you to adjust the voltage are even better because you'll get a lot better control of that temperature.
You might point out that if you really want to get the most of your terpenes, really set the temperature below 356. In other words, 350 is probably an ideal setting to get the most terpene profile out of your particular product. And this is really important in the way you actually use it. Now, Amy, there's also a way of looking at a dosing formula during the day. I know that, for example, if we look at the onset and the duration, things like vape pens work almost immediately and last only really about 2 to 4 hours. And things like edibles may take up to 2 hours to work and can work as long as 10 hours. This is really important in setting up your daily regime.
It is, and this is where it's okay to understand that you might use more than one product throughout the day. For example, say you wake up and you're in extreme pain, you might use something like a vape pen to get some immediate relief, and then you might take a part of an edible at the same time to help when the vape starts to wear off. The way that this would work is we know the vape isn't going to last very long, and as that vape is coming down in like how it's working for you, we know that the edible is going to be coming up and kind of taking over that spot where the inhalation or the vape pen just helped you out. So probably wouldn't experience a huge high by combining them because they're working on different timelines. And so it's a good way to get the relief that you need immediately, but also addressing the symptoms and relief that you'll need throughout the day.
Sure. It gives you the coverage you need during the day. And actually, you can use edibles, you could use tinctures, sprays, but
Yeah,
typically people use a couple of
absolutely.
different routes of administration to cover their entire day.
Yeah, absolutely. I would always recommend try a variety of products and pick things that you're comfortable with. So if you've never been a smoker, we probably wouldn't recommend inhalation or flower. So you might look at a different, maybe a spray to help get you those effects.
Sure.
Yeah.
And I think also it should be pointed out, I use topicals a lot. I have herniated discs in my neck, and I'm looking for instant pain relief. It doesn't last a long time. It lasts a couple hours, but it works immediately, and I think that's really something that's important. So mixing and matching these really should be part of your a part of your regime, and it's what you're comfortable with. What you mentioned earlier, Amy. If you don't like smoking, stay away from the vape pens and the flower. But if you do like it, there's a way to go, and I would recommend vape pens over flower primarily because you can take advantage of the terpene profile.
Absolutely.
So, Amy, we covered a lot of information today. One of the things I think that's really, really key is really dosing. And I think you have some pretty good comments about this.
Absolutely. So I am a huge proponent of journaling, especially when you're a newer patient. Journaling is going to help you figure out what products are helpful or not helpful for you after you take them, how long it takes to actually feel the effects, and then how long are those effects lasting for you. Because in the end, what we're trying to figure out is what's a helpful dose and how often you might have to take it. I find it's pretty hard to figure out those things if you're not keeping track of how they're working for you. Because I will tell you, if you take a product and it works well for you and you go about your day, you probably aren't thinking about the product that you just took and thinking about how it's working for you. You're just living your life, which is what we want. But we also want to keep track of how well it's working for you, so that you can pretty much what we're doing is we're trying to help you find a regimen that's going to work for you throughout the day.
I know that this was very, very helpful for me because when I had my knee operation, concentrating on a higher THC to CBD ratio, thinking about managing the pain, what I found out was by doing this journaling is when I used a higher CBD to THC ratio, it actually did a better job of managing my pain than using a higher THC ratio because it got rid of the inflammation, or it addressed the inflammation, brought the inflammation down, which brought the pain down, which helped with my pain management.
Absolutely.
This is I think is really, really important to be able to
Absolutely.
get the most out of your product.
And I think it's also really helpful for addressing, is it effective or is it not effective as well? Because it's also a good way to identify, like, hey, this product didn't last as long as I was expecting it to, or I didn't receive the effects that I expected to from this. And then you've journaled it, you know how it works for you, and you'll probably not use that product again, and that's okay.
So, Amy, we've covered a lot of information. There's a document called the Medical Marijuana Patients Guide that's out there. You've been very instrumental in helping put this together, and I think patients should be able to take advantage of this. Tell me a little bit about what you put together.
Yeah, absolutely. So we wanted to make our patient guide just really user friendly. It's going to give an overview of the laws and regulations that govern the Florida Medical Cannabis Program. It's going to give you an overview of how to apply for your card, some frequently asked questions, questions about smokable flower or vapes in the state of Florida. It's also going to give you the routes of administration guide, a sample journal. I think most important though is there's actually a glossary. It's really helpful with just understanding the basic terms that you're going to find as you're starting to use cannabis products or when you're going to a dispensary. So that way it doesn't seem so, out of left field when somebody says, hey, this is an indica. You'll have an idea of what they're talking about, and you'll have an idea of what to expect from that product.
Yeah, I think people should understand that, whether you're going to a baseball game, you're going to a football game, going to church, whatever you're looking at, every organization, every entity has their own jargon, has their own set of terminology. And the same is true for cannabis. Cannabis has in the whole world that cannabis has, the indicas, the sativas, that type of thing. And this glossary is really important if you're going to use medical cannabis to really make yourself comfortable and feel comfortable. And then people can pick this up from going to the MMTC website. You can get a digital version. And also, I think going to a MMTC clinic, you can actually pick up one of these at the MMTC clinics as well.
Yep, we do give all of our new patients and transfer patients a copy of this. It's just a great guide for cannabis in the state of Florida.
So, Amy, we've covered a lot of material. I think that one of the main things I want to point out to people is our YouTube channel, YouTube/Marijuana Aware, where this video plus all the other videos we have for our webinar series and also for educational series are posted, and naturally our website to be able to look at other webinars coming up. And I should point out, this is one on relief. Next webinar we're talking about is going to be on edibles, followed by a very special webinar for veterans and first responders. And also we're going to cover a whole bunch of frequently asked questions. So, Amy, do you have any final comments on this?
Yeah, most certainly. So, of course, I'm always going to recommend journaling to figure out products that are effective or ineffective for you. Start low and go slow with your dosing. Remember, you can always take more, but you can't take less than you already took. So just take it easy in the beginning. Understand that relief might not be instantaneous, and it does take some trial and error to figure out what products and doses work well for you.
And I think it's important that really cannabis is, people call it a journey. It's a way of life. It's a way of really helping you be able to address your particular condition. It helps you get your life back. So following a lot of the processes that we talk about, and also using the products and the terpenes that we talked about in this particular webinar can help you quite a bit. I hope this has helped you get your life back. And please join us for the next series of webinars to help you go through not only your cannabis journey, but to get the most out of your cannabis experience. Thank you very much for joining.